Hi, I'm Dr. Brittany Bryant. I'm an assistant professor in the Department of Psychiatry and Behavioral Sciences. There are so many things that excite me about my job. One of the biggest things is just the opportunity to be able to collaborate and serve my community. I'm a community engaged researcher. And so my ability to be able to hear from and center the voices of those that I serve, primarily Black youth, Black justice involved youth, historically excluded youth, that's what's most exciting to me. I get to wake up every single day and take what I dreamt about, the things that I envision, and be able to make those things a reality. My research focuses primarily on understanding the impact of discrimination on substance use, primarily for Black justice involved youth. I also am very much so interested and focused on opioid initiation in the Black community, as well as sexual health and sexual risk reduction for Black girls. And so when I think about the work that I do, primarily with Black and Brown youth, historically excluded youth, youth who are part of the LGBTQ community. One of the things that I love the most is being able to create programs, culturally adapt interventions, but do work that is going to positively impact and address the needs, the unique needs and challenges of the Black and Brown youth, the historically excluded youth that I serve. And so very often I have this mantra or um, this vision kind of mission statement that I go by, and it's that I want to make sure that the work that I'm doing is breaking down and addressing risk, barriers, and inequities. And that's why it's so important to me to be able to center those voices. In the work that I do. Youth in particular have much more insight than we sometimes give them credit for. And the information and the knowledge I've gotten from them has been so life-changing, so impactful, and so informative. And I'm honestly just grateful. I actually was supposed to be a clinician for my entire life. I built an adolescent substance use treatment program back in the day. And one of the things that was very unfortunate to see when kids came into the adolescent substance use treatment clinic with me, Black kids came by way, usually by the Department of Juvenile Justice, and white kids came by way of a parent referral or a school referral. And that was problematic. That was problematic for me. I always also noticed that there were differences in the treatment outcomes for Black youth versus white youth. And so my white youth could go through treatment, they would get the information. We could see some of those reductions in their drug screens. In my Black youth, we weren't seeing the same outcomes. So I went back to the literature and I wanted to see if there were any interventions that actually spoke to racial trauma, racial discrimination, discrimination distress, and how that is in some ways tied or associated with substance use and how we can address that, reduce the substance use, reduce discrimination distress, and also improve mental health. And I really couldn't find anything. So I thought it was important for me to be able to create that. And that's how I moved into research. I wrote a grant where I could partner with Black justice involved youth, with community members, with the parents of Black justice involved youth to co-create and culturally adapt a substance use intervention together so that they are able to tell me what they need, what they would like to see in an intervention. And we can develop that and actually hopefully see the outcomes we intend to see, particularly for Black justice involved youth. I'm also excited about understanding the pathway and trajectory for opioid initiation, particularly for Black youth. We are able to see right now that the Black community, particularly for adults, has higher rates of opioid use and opioid overdose. But we're not able to see the same thing when it comes to Black youth, primarily because we don't have as many Black youth, thankfully, who are using opioids. But it's important for us to get ahead of things. So when we see some things happening in our adults, it's important for me because I work primarily with adolescents to be able to look at our youth and say, what can we do to be preventative and making sure that our youth are not on the same trajectory, right? And we can, in some ways, start now with our young people by preventing that trajectory into opioid use disorder.